Hello. Hopefully I am live. Give me 1 second, everyone. Um, Wait, I'm not sure why this thing is still buggy. Give me 1 second, everyone. Am I live? I think I am. I think I am. Yeah. So I guess I'll start off like that, even though it kind of still shows a bit glitchy. But anyway. So hello everyone. Nintendo Nuts back here once again. Hopefully y'all are having a good Saturday. Um, yes, I am back with another live stream. Uh, just wanted to do a quick one before well, not really a quick one. It's kind of more like the big one, one of the big ones I want to do towards this series. Um, if you hear like any, I guess like noise in the background, I apologize for that. This microphone is sometimes a little more sensitive than I thought, and I'm still kind of messing around with it occasionally. But anyway, so yeah, so today, well, this week, um, yeah, so if y'all watched yesterday's live stream on my Mario Kart 8 Deluxe, thank y'all so much for watching. It did have so much fun. I did see that there was a like and pretty good, interesting amount of views, which I do appreciate all that. Definitely was still fun, and I'd like to do that some more sometime. So definitely be on the lookout for that. And let's see. I don't think I do have one minor announcement, but it probably won't be until the end of the stream. Only because I just want to. I just kind of I'll leave that till the end because it's not really much of a big one. It's just more of an update, in general in school and regarding all that good stuff. Hopefully my voice is being out recorded. It's because I have like so many stuff on my desk. It's like I don't want my voice to kind of like not be heard or anything like that. But if any problems with the audio, just let me know, please. I would appreciate that because I can only test so much myself. But yeah. Anyway, so this week I wanted to do a live stream to continue on to the Abnormal Psychology series. So last week, like I mentioned, was my first exam, so I did pretty good. I did pretty good with all that stuff. And so now we're kind of at the point where from here on out to the end of the semester, we're going to be talking about the different kinds of abnormal medical abnormal mental health. Sorry about that. And we're gonna learn about different kinds of mental health conditions, how to treat them, what causes them, and all that good fun stuff of abnormal psychology. So so with this week, what better way? Basically, what better way to start off with than learning one of the most common abnormal abnormal conditions out there, and that is anxiety. Now, with anxiety, it is a bit of an interesting topic, and the reason why I say this is because I believe realized this from this week's chapter that I read. Um, there's actually so many abnormal psychology. So many anxiety-related disorders that even I wasn't too aware of myself. That I kind of knew the conditions beforehand, but I didn't realize it was all grouped into one category, basically, based on the chapter alone. But yeah, so before I start once again with this series or with this week's actual topic, do not please don't take any of this as a form of medical advice. If you have any like medical related questions or concerns, do please see your general physician. I do highly recommend that. All this is just trying to share my opinions, share my opinions, have discussions, and kind of at least briefly generalize the types of abnormal mental health conditions with you all. So yeah. So with all that out of the way, let's get started. And of course, I do have my textbook right here with me. Believe me, this chapter is kind of big, everyone. So I do apologize that this may be a little bit of time. But again, I will try and like make everything as general as possible because again, it's a huge chapter with so many conditions. I don't want to make this live stream longer and like too boring as as what it needs to be. But anyway, so yeah, so hopefully, so anyway, starting off with anxiety in general, we all have that certain. We've all been through that, like literally. We have um, there's fear, there's anxiety, there's all that good stuff. But for example, and I guess one thing I can actually relate to myself is like when we have a test coming up. Obviously, when we have a test, what do we get? We have fear because of what if we don't pass? What if we don't study hard enough? What will happen in the end? Um, and then we also have let me see real quick. I'm sorry, I'm just trying to make sure everything's fine again. Anyway, so yeah, so we all have that fear, and fear is obviously something that we don't want, but it just happens because that's how sometimes our psychological works. I mean, that's how we all are. We all develop fear for several different reasons. We have a test. We're afraid of I mean, we're nervous about some activity or event coming up, or or for example, there's even people are nervous about uh, relationships. Obviously that's a common thing of having anxiety and nervousness. So that is definitely one thing that we all have. That's all a common norm of us as humans, because we all have anxiety regardless, and that that's something that we can actually control. However, for people who actually fall under these type of abnormal mental health conditions, they tend to have it for a longer periods of time, or it tends to basically affect the daily life of functionality. And that is actually true regarding all that, because I mean, yeah, it's normal for us to have fears or anxiety for some things, but these people tend to have them one more often than others. Two, it can affect their daily lives, or three, it can basically just corrupt them altogether. So one of the most I guess what we'll start with is one of the most common conditions is called generalized anxiety disorder, which is GAD or GAD for short. And with GAD, people with this, they always tend to have anxiety. They always tend to worry. They always tend to have those fears within them, and they really can't, control, they really can't control it on their own, and it obviously overtakes them for what they do. And the reason with that is because well, there's so many different causes. But first, I guess to kind of start, what is GAD? Obviously, GAD is generalized anxiety disorder, like I mentioned. And with GAD, they tend to have it for a little bit longer than 6 months, give or take around the time. And they also tend to, and I'm sorry, I'm actually going to have to reference to my book because there's only so much I can remember off the top of my head currently. And also with, I mean, yeah, it's a little bit too much information for just to kind of like just rely on my knowledge for now. But anyway, so basically, what is symptoms of generalized anxiety disorder is like fatigue, you know, you know, concentration can be decreased. They can always be, they can have like also a little bit of mood swings, you could say. Sometimes they can feel, just obviously nervous. They can sometimes show it, or sometimes they can't. Sometimes they can't sleep, which is insomnia, and once again, it lasts more than 6 months, and it just basically you can see that there's something like an impairment of them that they just can't control. So within that, that is where we kind of go on over the causes of generalized anxiety disorder. And the way how, I guess the way how one, this is how I learned it basically, but I'm not going to actually explain, in detail of how we kind of define, each disorder. But the way how we're supposed to do it is we go by different models. in abnormal psychology, and from there, there's different models within. It's kind of like a basic structure of how we define the cause of each condition. For an example, there's a biological model, and obviously from that, if basic biology, it obviously comes from within ourselves, like physically, like why do we what's wrong with our biological, or basically our anatomy or physiology. Why are we developing this condition based off of that biological model. Just kind of give you all an example on that, but obviously I'm not going to go into detail in each model or method, because again that would be way too long, and that'll take me a little bit hard for me to explain each model in general. And yeah, this is more like a general type of thing I'm talking about, so yeah, let's not do that. um, but either way, I kind of like just go by a list in terms of like in general the common causes of these conditions from here on out. But yeah, so one of the common conditions of generalized anxiety disorder is, well, one thing you can think of is poverty. Now, poverty, that's something common, and the reason why is because you can tell, what is it? Because a lot of people always worry about the finances and the way of living. Let's say you live, let's say, just give, I guess, an example. You don't have like a good job, and you live like in one of the lower ends of of the population, or I guess city or suburban area, or province or something like that. Well, obviously, it can actually tend to be a little more stressful for you, because you need to find a way to make ends meet. You need to obviously have so much responsibilities within you, yet you can only do so much. And that is where one cause of GAD happens. And from that is where things tend to that's one of the common reasons why anxiety happens in the first place, because of so much worry, so much stress. You can only handle so much from it. Now, so moving on from that, just kind of like giving an example, and I guess to also kind of like bring up an interesting fact in general. A lot of these conditions, well, at least from this chapter or this week's discussion, I've found out, all of them tend to be, I guess, like more like the cause will be towards more females than males, which it's interesting. But then if you kind of think of it from a research standpoint, it does make sense. But again, I obviously don't know the reason why from that. But a lot of these conditions, they happen to be on a 2-to-1 ratio. And what I mean by that is, like, for every 2 women that develop this type of disorder, which is, or obviously for example GAD, 1 male will get it. So it's kind of like an interesting fact to kind of throw you all out there. But yeah, that's one thing I've kind of found out from all of this chapter by itself. Of course, if there's any differences, I'll obviously state them. But that's one of the most common things I've seen for each condition here. So basically, another reason why people can get generalized anxiety disorder is based off of the past experiences. And one common one tends to be the childhood. Now, the reason why this happens, it's a little bit, I guess, confusing. Because even I don't fully understand it myself, at least yet. But it seems as to happens when the people who get GAD, it happens when some of them happen to get it when they were a kid, and basically that instance of fear kind of comes back to them as adults, and then they tend to get the same symptoms or condition as what they did when they were younger. And that's an interesting thing, because even I wasn't too sure about that. But it is an interesting model to look at. But yeah, that's another reason why they can tend to get GAD, and that's basically off of from their childhood experiences. So I guess you could say it's like a flashback in terms of how they get it. I guess some event must trigger it to happen. Um, which I guess that, well, I don't want to say it's kind of like PTSD because that's not really what it is, but something basically within their unconsciousness kind of awakens them from I guess a certain event that makes them again have anxiety, and that turns back into generalized anxiety disorder. Now, actually, one thing I did notice that was actually real funny. Um, if y'all are Disney fans, which I'm pretty sure there's a lot of people out there that are, I've actually watched a couple of Disney movies myself. If y'all have ever seen the movie called Inside Out, there is a certain character that actually does display generalized anxiety disorder, and it's actually true when you actually watch it. I did watch it actually this past, I think it was 2 days ago. I watched it, and they actually did do a good representation of what generalized anxiety disorder is. And I was like, wow, who knew that Disney was able to actually make, movies based on their, based off of, actual mental health conditions, which I think in general, if you actually take a look at that, actually, the characters actually tend to represent the, some common, mental health disorders. Obviously, I don't know all the other ones yet because this is really the first chapter I dive into. But I'm pretty sure like the other ones, they actually give a good representation of of what the mental health condition is. Now, another reason why people tend to get general GAD, I'll call it GAD from now on, or GAD. I'm not gonna so I'm not gonna say the full um, picture of it again. So yeah, GAD. Another way to get GAD is based off of like how we think of ourselves. I guess you could say like in the current months, and the way we see that is, for example, a lot of us tend to know how we feel, how we interact with others, personally. But then there's some people who kind of like want to deny that thing about themselves, like you know deny that feeling, deny that situation that they're currently in. And by doing that, they tend to kind of build up anxiety towards themselves because they try to overlook that false, I guess you could say, insecurity or that false thing about themselves, which in reality it's not, but that is what they tend to believe in terms of themselves. And that's why they develop, that anxiety and all that, because they don't want to look into basically the truth of how they feel about themselves while they try and just hide it from others and even to themselves. So from that, they obviously try to hide it, and they just build off from that, I guess, shadow, you can say. And from that, they tend to develop anxiety and stress. But anyway, so yeah, so another reason why is actually the way we think. Now this one's actually a bit of an interesting one as well, because the way we think, it obviously thinks how we always think that always the correct way, but then there's some people that tend to make the false decisions, and that is where the cognitive or the thinking skills need some type of help or support. But obviously, before that, the way they think, the way they you know make decisions for themselves, it may not be the best ones, and that is where another reason why GAD comes into play, because from the wrong choices, obviously it comes into anxiety, it comes into nervousness, uh, insomnia, and all that symptoms of GAD comes into play. But that is kind of like the way how some people think with GAD. They tend to always think. I know it sounds a little bit similar to the where we think differently about ourselves, where where we hide the truth basically of how we feel about ourselves. However, with the thinking approach, it's a way how we make decisions in our everyday lives due to based off how we behave and how we think the right decision is, for ourselves. It's not that we're trying to hide it. We actually do try and make the right decision, but obviously sometimes people don't do that. And from the false decisions, it comes into general GAD once again. So another, I'm actually going to kind of, because here another way how we actually treat it is different ways of, from the book it kind of tells us like how we're supposed to treat it, but I'm not going to like again go into specific details on that. I'm going to kind of sum it up into each condition. But another way we can actually get, GAD is from our actual own brain cells. And that's kind of like where I guess my example, the biological model comes into play. But again, I'm not going to be for each model that I know about. So basically, the way we can get it, like, not physiologically, is the way how our brain functions. And because each of us has a brain circuit, and brain circuits are our way of processing thoughts, processing memories, processing or basically what we're supposed to do everyday lives. Get from one place to another, eat, sleep, do all that good stuff. And they tend to live off of the brain circuits we do. However, for people with there's another circuit that we have which is called the fear circuit. And while the fear circuit is basically what triggers our fears and anxiety, sometimes those fear circuits themselves tend to be overhyped, or it's overactive. And when that's overactive, that's when people develop the GAD, because it's obviously something within the brain that needs some treatment or some type of fix to kind of have that fear circuit come back into normal. I'm sorry, I'm just 1 second, please. Anyway, so that is one reason why. So that's another reason why we kind of develop GAD, is basically from a brain function as well, or our brain structures, and from that's why you would probably need to see a actual doctor so that way they can have that treated for you. But so kind of how we treat GAD, it's kind of I guess a little bit obvious if you think about it, but it's a little bit more into perspective depending on the cause of it. For example, those who kind of have like those who kind of have like the reason because of their brain circuit is, for example, that is where you kind of need like medication, which is a benzodiazepine. And for those, if you don't know what a benzodiazepine is, it basically is a medication that helps trigger or helps kind of like relax the circuits themselves, and helps the person like think calmly and all that stuff. For example, some common benzodiazepines I can think of is one, obviously if it comes to mind, Xanax, or of course the generic name you can name is alprazolam. And of course there's like other ones such as Ativan, and then there's Versed, and then there's also Ultrium, and all those other kind of lorazepams. They tend to help. All those kind of benzodiazepines help the brain to kind of calm down, and just to relax and help the brain kind of think properly, or at least kind of react properly as to the way it should be. Now, what's another reason why? So anyway, now another treatment we can help GAD is by therapy. Now there's so many different kinds of therapies, and again it kind of falls into the same different types of models perspective on how you treat it. But again, therapy in general, therapy is an option that kind of helps people talk out the reason why they think the way they they do. They try and therapists help make sure to think. They try to interact the way that they think about, and they try to basically help the person overcome the anxiety and all that, the GAD. But yeah, so yeah, therapy is also another option, which, and in general, it kind of just depends in the end how a doctor or a psychologist wants a person to be treated based on the symptoms, based on the reason behind it. But sometimes it's kind of like on a both medication and therapy type of thing, and eventually it just depends how they end up in. But the good news is, with treatment, a lot of people tend to get the help that they need, and they tend to kind of go back to normal. As well, not back to normal, but they tend to feel better about themselves, and the disorder tends to already go back into each other. Um, and I'm sorry, everyone. Let me take a quick break. I will be right back. Okay, I think I'm back, everyone. Okay, so sorry about that. Went to get a drink. Um, I prefer lemonade. Anyway. So yeah, so what was I? So I was talking about oh yes, the treatment for GAD. So after that, that is about it. As far as treating GAD. Generally, with and after, sometimes therapy can last for a couple months to even years, actually, depending on the condition. However, again, it depends on the per patient or client, and that is where it will just play out. So anyway, so moving on to the next type of disorder, it is a phobia. Now, phobias, I'm pretty sure all know what that is. At least the basic type of phobias. So obviously everyone is scared of something. Not. I mean, that's obviously another fact about us. No one is not scared of anything. Um, but there are some people who tend to obviously have specific phobias, and and basically the first type of phobia disorder there is out there. And the way a specific phobia is basically uh, anything that basically a person's excessively afraid of, to an object or situation in general. For example, there's people who are afraid of spiders. There's people that are afraid of traveling, which actually I'm going to talk about that right now. And there's other phobias I can think of out of my head is like snakes, insects. I know some people are even like, I guess like even, well, no, it's because it kind of falls into a social anxiety disorder, but that's a little bit different one. And yeah, I mean, yeah, there's different types of phobias out there in general that you can think of. Now, a specific type of phobia that I can actually think of is called agoraphobia. Now, agoraphobia is a fear of people that are just that they don't want that they're afraid of leaving their own home or place of living. And surprisingly, there is actually conditions out there. I mean, there is actually people out there that are have this type of phobia, and it's not easy for them. They're always afraid of of leaving the house. They're afraid of traveling. They're afraid of going outside, even on just in public places to get a cup of coffee or just to go like even like get groceries or get anything they need, even like that. They all still have that phobia with them, and that's why they just tend to live inside the house themselves. So which is so I guess in general, like what going back to kind of phobias in general, what causes them. Now the reason why we tend to get phobias, and one of the most common ways is kind of like learning them. And the way how we learn phobias is it's kind of behavioral. And when you think of behavioral, when you get a behavioral phobia, it's kind of happens when two events happen at the same time, and your brain processes those two events, and from that event, they tend to connect together, and that's where you develop your sense of phobia for that particular object or reason. But yeah, so in basically through behavior or learning, how we learn phobias, that's how we tend to develop them. Say for an example, you're walking along the park, and yet you see at first you think it's a cute little dog, and you want to pet it, you want to hug it, you want to obviously play with it, but when you reach out your hand, you know the dog bites you, and when he bites you, that's more of like a negative thing that happens to you. So what happens is, from that experience, you tend to kind of not be afraid of dogs, but you're afraid of going to parks. Which I know it's a little bit, I guess, not confusing, but that's kind of like how behavior works when it kind of combines both situations together or objects together. But yeah, that's how like phobias in general, how we can develop them through learning. And yeah, so one other way we can actually get phobias is um, you know how we learn and all that stuff. And kind of also the way how we think also plays into the way a phobia as well, because once we develop that, you know, fear connection of that specific phobia, well, we always think that item or object is bad, and we always tend to avoid it because we think that it'll cause fear on us. And from from thinking like that, that is well, okay, well, that's when another condition happens to come into play, and we always tend to think of um, that's where we always develop that own aspect into the phobia itself. Um, Now, how are they treated? It kind of just comes down into the same aspects of like GAD, for example, except this time, um, for example, I mean, benzodiazepines are still kind of given for people with phobias. However, it just depends again if they really need it based on the current symptoms and signs and all that stuff. But again, it really would depend. But obviously, therapy would most likely play into a role into getting over a phobia. And one example of getting over a phobia is through exposure therapy. Now, exposure therapy, just like the way it is, it's kind of getting exposed to the object or situation up close and personal. Now, obviously, it wouldn't be, right there and then, like, for example, a therapist just gives you a spider right there and then. No, that's not how exposure therapy works. They have to start by little. So, for example, if a person who is afraid of spiders, and I'm sorry, spiders are kind of like the most common phobias out there, so it's actually just, I'm kind of like bringing it up again. Um, so yeah, as far as like people who are afraid of spiders, first they start small by kind of like describing the spider of how it is in general, but no pictures or anything like that. So the next time they have a session, they tend to maybe show a picture of a spider from a book or anything like that. And then the next session, they tend to show like a video of what a spider looks like. And then the next session, they tend to show you an actual live spider, and just like little things like little increments at a time as to exposure therapy, of how to get over fear. Now again, obviously it's not like one day after the next, but through several months and through several sessions of therapy, they tend to grow into that aspect and overcome their fears. Now, kind of same way goes with that goes the same way as with agoraphobia. For the people who travel, they need to take it also little by little. Now, obviously, since they can't leave the house, the therapy would most likely be considered in their own home. And with that, the therapist goes into a home and they kind of like kind of give them like feedback and reassurance, that outside it's safe, and things like that. And from there, that's where they kind of start taking the little steps to try and overcome their fear. And from there, they always tend to. I'm sorry, I'm trying to check something real quick. They always tend to get them basically to the point of out of the house completely. So, like for example, the first day that they have therapy, they have 1 foot outside, and that's it. I mean, yeah. I know for us it kind of seems a little ridiculous, just 1 foot outside and that's it, But for people with agoraphobia, it's necessary in order for them to overcome their fear of being outside and traveling. Um, but yeah, I mean it's kind of a similar procedure as to kind of like how people with phobias are treated in general. So it's basically a lot of like with exposure therapies, getting used to it. So I mean, I guess for anyone who's out there, scared of anything, try maybe exposing a little bit of yourself, um, to kind of overcome your fears. But But again, don't take my word for it. Each person's different, but just kind of a little tip right there. But anyway, so yeah, so with the period of sessions and with the period and also with medication if needed involved, eventually people with any type of phobia they can always learn to overcome it, and they tend to just like the phobia overall. But yeah, so moving on, the next type of anxiety related disorder is social anxiety disorder. Now, like the name suggests, yes, it's kind of like, and yeah, actually, if you actually just use the abbreviations, it's actually SAD. So yeah, SAD. I guess that's the way I'll call it from now on. SAD. But one way to develop SAD is basically where people tend to get anxiety based off of social situations or social experiences. For example, even if they are just like with friends, at parties or at a gathering, or even I guess you can also obviously like in a school project, they're afraid to socialize. That can also be another SAD related disorder. Now, common things to kind of explain the perspective of SAD. Again, this is a 2-to-1 ratio where twice as women are likely to get it as men. Although this one actually anyone can get it from any type of culture. So I mean, there's no specific culture needed. Specific culture is more likely to get SAD than anyone else. It's more of a general type of I guess a gender difference related disorder. But the symptoms of SAD is basically like obviously anxiety related to the disorder, social situations. Another one is actually avoidance of all social group gatherings. And another common thing is that they tend to kind of put themselves down, or they always have that fear that they're not good enough for that social group or that special person. People tend to think with SAD, they always tend to think that they're not good enough, that they're afraid of if they don't accept them for who they are. They tend to always have that belief where they just won't be accepted anywhere, and that they are better off alone. And and obviously people who have SAD, they tend to be isolated or just be themselves. And from that, obviously you can go into other different types of psychological issues such as depression, and even the worst case scenario could be like suicide. But again, I can't go into details on those yet because one, I haven't even learned that myself in detail. But I mean, it's kind of a thing that kind of connects to each other, as you go along. Now, another there's no actual, I guess, cause you can say of SAD. I mean, I guess the only reason, the only cause is just basically either through like personal experiences, or I guess the way even how as a child you grow up with. If you weren't really that social, it can probably obviously play a effect of you in the later adulthood life. And that's how it generally develops. And from there, that is where people, develop SAD, and that is, how they need to get treated. Now, kind of like with phobias, people who have SAD, they need to have exposure therapy, or kind of at least reassurance through a therapist or psychologist or whoever, because they always tend to have that fear. They need to kind of be taught how to be exposed, even if it's again little increments, just like with phobias, how to overcome that anxiety. So for example, I mean, for people who have SAD, a therapist could tell them, go to an event, and sure enough, when they do, things normally turn out fine for them. Of course, there'll be times where they have second thoughts, but and obviously it won't be easy for them initially, but as time goes by, it will get easier. But as they get more exposed to that type of therapy as time goes by. But yeah, and then of course, like with other, anxiety related disorders, medication is an option to kind of relieve the stress, the nervousness and anxiety. However, again, it just depends on how severe it is and how badly it affects into a person's lifestyle. If you're a person that, or if there's a person that needs to be social with people, obviously that's going to be a little bit more harder for them because they really need to get that, disorder out of them, as soon as possible, so that way they can fulfill, better lives. But yeah, that is social anxiety disorder. And so now that, going into another type of related is panic disorders. Now, panic disorders is kind of like anxiety, except the way how panic disorders is, it happens out of nowhere. And that is where panic attacks come into play. Now, panic attacks is kind of a serious, well, not serious one, it is kind of a little bit of an interesting one. Panic attacks typically tend to come out of nowhere. And with panic attacks, panic attacks or disorders, a person can get will panic out of nowhere, panicky out of nowhere. They can be fine one minute, and then the next they can just have a full blown panic attack. Now again, with a panic attack disorder, there's symptoms can obviously include like heartbeat going fast, so they can be sweaty, they can just be just shaking, agitated, they can just want to like move around quickly because of that. And with panic attacks, obviously they all have that as well. Now for us, obviously we do kind of, sometimes we may get like panic attacks. However, people with panic disorders, they have them kind of constantly. Obviously, I know given time, but they have them more frequently. And in order to kind of disclose it as a disorder, it would be once again like a 6-month time frame that they would need to have frequent panic attacks. And of course, one thing that they can always be concerned about is having additional panic attacks. So that's why also, I guess, like anxiety does come into play, because they always worry when the next one will come. Now again, with panic attacks, kind of does fall into, it could also come from the brain itself, and that is kind of the way how, I'm sorry, just real quick, how basically the part of our brain that focuses with our anxiety, that's where it kind of overreacts. Like, I guess like the same thing as with the brain circuit. If the brain circuit, doesn't know how to, control itself, that's where, our brain misinterprets that overhypeness, and that's where we obviously get into some problems when it comes to panic. And with with the brain, that's where medications again come into play in terms of how do we treat this, this type of panic disorder. And again, yeah, medications is also something that is one thing that you can do. So, yeah, well, okay, so I think that is about, let me see, it for, so again, therapy is also another way to kind of relieve panic disorder. Panic disorder can obviously, come and go. It just depends on the treatment, how they get and how frequent it is. But again, it kind of relies on, one thing that I guess I'll explain is kind of like cognitive therapy. And cognitive therapy is kind of like, basically the way how we think. We need, like, the therapist helps us change how the way we think. And through that kind of therapy, it kind of helps, people how to overcome the panic disorder and how to kind of like ease, if they do get a panic attack, how to possibly even not have a panic attack in the first place. But yeah, so that is another way to, think of panic disorder, and that is one way, that's another type of, anxiety related disorder that many people can get, but, it's not uncommon for them to have it. So the next type of condition that I want to talk about, and I think this is actually the last one, if I am not mistaken. Let me just double check here. I do believe it is the last one. Yeah, okay. Yeah, this is the last condition of anxiety-related disorders before I end. Sorry, everyone. The last type of anxiety disorder is OCD, which is called obsessive compulsive disorder. Now, people with OCD tend to so it's basically OCD is kind of a way how it changes our consciousness, basically how we live. And OCD isn't really specifically a one type of disorder. It kind of is connected to like GOD or GAD, or a phobia also. But obsessive compulsive disorder is kind of where a person is like fixated on a specific thing. And actually, I don't want to like actually. It's because I don't want to give you all the wrong information at least. So basically OCD is like a repeated obsession. So for example, and I will actually be giving like specific examples on how this is. OCD is like an obsession where it really does affect you in your everyday life. Such as, I guess for example, there is one that is called hoarding disorder. Now, hoarding disorder is where people are obsessed with collecting anything that they find or that they gather around the house, and they cannot let it go. Now, there is some serious people out there that are really just that have collecting issues, and like some people can have collecting issues just over like a newspaper. And and as weird as it sounds, it really is something that doesn't need to be considered, because they keep that newspaper and yet they feel safe. And the reason why people sometimes feel like the hoarding, some reason why people get hoarding disorder is because they feel safe. For example, there was an example where people tend to get like for example, a loved one passes away. Well, when a loved one passes away, they tend to obviously, maybe go through some mental health, obviously some situations, but one way they kind of grieve that thing is by collecting items. Now, first, it's kind of like out in the ordinary where you buy stuff and then you don't want to throw it away, but then it comes like everyday materials that really should be thrown, like newspapers, trash bags, or garbage bags, and even like cups, lids, bottles, basically any item you can think of. Hoarding disorder, people can just collect it, and to the point where you can't even see anything in the room. And in fact, people with that disorder can have trouble even living normally in the home because of all the clutter that they have, and it really is something that needs to be addressed. With that kind, and obviously with that kind of disorder, that is where the treatment is to kind of like get them to feel that they really need to throw it away, and from them throwing some items away, they kind of improve on the disorder. Now depending on how severe the disorder is, it can take obviously even years before someone can like even fully live in the home once again, because of one, of all the stuff that they collected, and two, the fear of disposing the items that they don't really need. But again, that is one type of OCD disorder. Now another one is called trichotillomania. Now trichotillomania is another disorder where it's not, and I guess I will say that it is a little more common in females. And, I mean, males can still do this, but I can understand why it's more common in females, and it's basically hair pulling disorder. And with hair pulling disorder, they tend to have the hair pulling disorder. Um, they always tend to pull their hair out of nowhere throughout the day. And with trichotillomania, they pull their hair out to the point where the scalp is completely shown. And this is obviously over the course of months or to even years, but it's something that it is shown eventually. And the reason why they kind of do that is basically kind of same thing with anxiety. They need some kind of like stress reliever or some type of relaxation. It's basically their way of like a relaxation technique. And through like hair pulling or even like skin picking, for example, that is a way where they tend to feel just better about themselves. And even though yes, it may help them as far as with the what is it, like the anxiety, it's still not, it's still affecting their health by them um, basically destroying the body cells, or like for example the hair cells. And just picking the skin kind of still also, it's really not an ideal way to kind of um, uh, you know relieve your stress, relieve your anxiety. Now, as far as treatment, I only know one, and that is by kind of just like finding an alternative method in terms of getting clearing your anxiety, and through that it does generally help. However, again, it just depends on how severe it is, and how long it takes for a person to actually recover from it. But within time and within treatment, people with trichotillomania, they eventually stop with the hair picking, and the hair fully goes back to normal. But so one other type of OCD that I've actually learned from is called body dis this well I'm sorry body dysmorphic disorder. Now, people with body dysmorphic disorder, in this one, it is a bit interesting. However, I guess I can see in a way where this can happen, and because body dysmorphic disorder is where a person is obsessed with changing their appearance because they feel it's not normal. It's not what is it like? It's not basically up to those standards of of looking good. And they'll do whatever can to basically change the way it feels. For example, people feel may be, and I guess it's kind of like falls into false insecurities about themselves physically and emotionally. But for example, people feel like the face, they need to put makeup on to hide all the like red patches or white patches that they may or may not have. Some people may feel like their what is it, like the lips may not be may not look good as the way as they hope it would be. Sometimes people may feel like they may need to that the body weight may not even be ideal. But then again, that will actually kind of fall into eating disorders. But I won't be covering that until a couple. Actually, I think that may be coming soon enough. Maybe not this week, but the following week, if I'm not mistaken. But regardless, yeah. So body dysmorphic disorder is basically an obsession where they need to change. A person needs to change their appearance because they feel it's not an ideal way for their body to be at for the satisfaction. Now, how do people get treated on that? It goes back to a therapy, but then again, it kind of like also needs to be like a realization where, excuse me, where a therapist kind of needs to make them realize themselves that they are fine for who they are. Because I mean, yeah, obviously, like for example, we know that everyone is different and everyone has unique features that no one else has. But people with body dysmorphic disorder don't see that. They need to change the appearance to make it look better appealing, and because they don't feel like they are, perfect themselves. Which unfortunately, that's not true for us the way we think about it. But to them, it really is a big deal. So basically the only way to treat it is kind of, again, like kind of sort of self-realizing that you're fine the way you are, and they really basically need to realize that, so that way they can feel good about themselves for one, and also kind of take away that additional anxiety or nervousness that they have within them because of that disorder. Now for the time they already now it can take some time for obviously to take care of that, but it is treatable. And that's one good thing that is about anxiety. OCD related disorders. So yes, OCD obviously OCD is treated in general, and once again, it all just depends on therapy and basically seeking the help that finding the solution to the problem that needs to be fixed, or try to think of a way to fix the self issue that a person is experiencing. And I'm pretty sure we all have OCD. Maybe not on, obviously that affects our everyday lives, but it's some of them obviously, like the conditions I just described. Those do affect everyone's day-to-day lives, and that's where treatment is necessary to be implemented for their own personal beneficial health, mental health. But yeah, so that is I think that is, yep, that's about it for this section, or this chapter, or this week's discussion on anxiety related disorders. So basically, in general, anxiety related disorders is one of the most common ones, or most common most common ways to develop anxiety. I'm sorry, I'm not getting my sentences right. One of the most common mental health conditions out there. But again, it's an interesting topic to kind of learn upon on, and it really does kind of open your mind as to see how many people really can affect it. And it's true. Some of them it may not be visible, but some it may be visible. That's why it's always good to kind of like ask people like, how was your day? Can I guess like pay attention to them, how they react, and to kind of see how they are, and help them out if they can, if they have any anxiety related disorders or any anxiety in general, because again, anxiety is not fun. Obviously, we've all been there. If you've taken a test or worried about a job or things like that, we have anxiety. So in a way, it's pretty relatable for anyone who has anxiety. But again, it's just all about coming together and always just supporting one another, whether it's friends, family, even strangers, to kind of understand that what, they're not the only ones that have anxiety, and we all been through that at some point or another within our lives. But yeah, so I think that is about it for today's live stream, everyone. I just wanted to do this real quick chapter on this week. So yeah, like I mentioned in the beginning, from here on out, I'll be focusing on actual mental health disorders. Like this coming week, I'll be focusing on PTSD, or post-traumatic stress disorders, and actually stress disorders in general. So that's something to look forward to. One good thing about, I guess, like this coming week's chapter, though, is actually not that many like disorders that to name. The only thing is, it does kind of have like a little bit of more information to talk about. So I'll kind of be focusing more on the information aspect than just kind of like listing them in general, like I mentioned, like I've been doing in today's stream. But yeah, that's not something to look forward to. And yeah, I think that is about it for that. I guess I do have one also minor announcement that I need to also talk about. I did actually sign up for my HESI A2 exam for I believe October the 14th. Let me check my calendar. Yeah, October 14th. And so it's gonna be pretty hectic these next couple of weeks, but it's gonna be worth it. It's gonna be fun. It's gonna be worth it. I'm looking forward to it. So I'm not sure if that will affect the streams as of yet. I don't want to get too ahead of myself, but for now, definitely do expect a good stream, at least 2 streams per week, which is one gaming related and one obviously related to this, series. But yeah, I may have some pop-up streams every now and then. Like, for example, maybe on Monday I might have a stream when I get back from out of town for my appointment, for my out of town specialist appointment for my vision. But we'll see on that. I'm not 100% sure on it, but we'll see on that. Maybe it'll be a gaming one. I'm not too sure. Something fun because since it's a bonus stream, I don't want to like just add more information to than I need to. But yeah, that's kind of like the main quick announcement I wanted to briefly share about. And yeah, it's gonna be fun these couple of weeks. Once it hits October, oh boy, it's gonna be extremely busy, and yet it's gonna be real fun for me. So hopefully, things will fall into place. But yeah, if you like the video or if you like today's stream, definitely do leave a like, comment to me. Let me see. I'm trying to. It's because I kind of want to think of like a good question to kind of ask you all. I guess since it's the first one for like this series, what do y'all think about this series? Let me know in the comments below. If you're watching this right now, if you're watching it afterwards, what do you think about this series? I mean, I know I'm not talking about like in specific details, but I do want to try and at least open some eyes or discussions on the different types of mental health conditions, and bring some awareness as to why we need to address these type of conditions more and more, because it's affecting a lot more people than what we initially realize. But yeah, hopefully y'all enjoy the series. Do let me know how y'all feel about it. I would like to know y'all's feedback. Maybe if I need to improve on something, maybe you want me to go into more specific details, do let me know. I would appreciate that. But yeah, so do let me know on that. And if you haven't already, click the like button on the stream. I would appreciate it. And if you haven't subscribed yet, please do subscribe if you'd like to. It's gonna be a real busy month in October, so definitely a lot more streams. So if you like to see more of whether it's gaming, my experience related, or more about abnormal psychology in general, definitely do check me. Definitely subscribe so that way I can lets me know that there's more people interested in it. And of course, since I'm leaving out of town tomorrow, no stream tomorrow obviously, but do follow my social media on my it's on the description of the video or the stream. I'll probably be posting maybe just frequently, just like little updates on how everything's going. Again, it's not going to be a serious appointment, it's just more like a checkup exam. But I'll be shopping around, so who knows. Maybe I'll show some good pictures if I do see any. But yeah. But anyway, guys, so I do believe that's about it for today's stream. If you like what you see, again, like it and subscribe for more. And hopefully y'all have a good good rest of your Saturday and a good weekend. And I will see you all on the next stream. Bye, guys.